Safe Patient Care, Nurse to Patient and Midwife to Patient Ratios Amendment Bill 2018, second reading. Resumption of debate.
Sorry, Ms Patton, I'm always thinking 2 steps ahead. I'll call Ms Patton.
Thank you very much, President. And as I mentioned earlier, I'm very pleased to rise to speak to the Safe Patient Care, Nurse to Patient and Midwife to Patient Ratios Amendment Bill. And it has been some time in coming. And certainly we nearly got there last year. And I felt terrible that we didn't get there. However, I would concur with Ms Crozier in her contribution that this bill is actually a better bill. And can I say from the outset that I heart nurses and midwives, and I wonder if Hansard could put an emoji in for that. I heart. But this bill, as we all know, it enshrines in legislation the minimum number of qualified nurses or midwives per shift to ensure the quality of care for every patient in the Victorian public health system. It's a good law. And it's practical, and it's what we would call no-brainer legislation. It's constructive, it's positive, it's reasonable, it's evidence-based. And it adds on to the Safe Patient Care Act that we passed in the previous term. We know, and the evidence tells us, that the number of patients that a nurse or midwife is allocated on any given shift is in direct correlation to the patient well-being and mortality and the class of care that those patients are provided. It just makes sense. And when we see an increasing ageing population, that those ratios are going to become more and more important and more pertinent to the future care of our community. We know that when there isn't a proper ratio, that people die. So this is as serious as that. This is absolutely saving lives. We know that being able to monitor patients more carefully, and certainly listening to Ms Crozier talking about midwives and what can go wrong straight after birth and what can go wrong very, very quickly, really certainly reaffirms why we need to ensure that the patient ratio is right. This legislation will apply to acute wards, aged care, emergency departments, labour wards, postnatal wards, NICUs, high dependency units, coronary care units, special care nurseries and palliative care. And I think palliative care is something that I would like to comment a little bit on. Having had the great privilege of being on the End-of-Life Choices inquiry and hearing from the remarkable palliative care nurses and the absolute passion that they have for their work and the care that the energy that they put into that. We certainly need more nurses, and certainly in aged care, and now when we're having the Royal Commission into aged care, we will find that some of that lack of nursing has caused some of the most awful problems that we have seen in some of our aged care facilities. So I'm very pleased to see that Victoria is doing this. And in fact, Victoria was the first state in Australia, in the world, to enact nurse-patient ratios nearly 20 years ago. This has been led by a very passionate group of nurses, and I have felt very privileged to have met with them over the number of times. Passionate / bossy, I think there could be both, but I certainly wouldn't want to cross some of those nurses that had very, very strongly argued for this, and not for themselves, but for the people that they care for our families that they are caring for in some of the most traumatic and often tragic times of our lives, and sometimes some of the best times of our lives, whether that's with the birth of a new child. I was really pleased also to see the Workforce Development Fund being added to this legislation. I think that's very positive. Looking at the speed in which technology is changing, and particularly in our healthcare system, also, as I mentioned, with the ageing population, being able to continue to develop best practices for nurses is is really important. And President, I think this is sensible, productive legislation, and I hope we see more of it. Certainly, I intend to help by putting more sensible legislation on the table, like the spent convictions bill. But I think this will be, and I hope this is the first of many times that this House will agree on laws that further add to the safety, security and happiness of our fellow Victorians. I commend the bill to the House.